University of Maryland H.E.A.R.T Regional Health has embraced H.E.A.R.T. It's really part of our culture. H.E.A.R.T is the demonstrated behaviors that are really linked to our values.
H.E.A.R.T is more of giving my heart to each individual I come in contact with, being compassionate, responding with empathy, treating others the way I want to be treated.
It means connecting with our patients and focusing just on them, on their needs, and on what it's going to take to make them feel better and get them through this trying time.
So H.E.A.R.T here is that framework that we learned that lets us get in and be next to a person and their soul, so that then we can connect with them and provide better care.
It makes me do my job a little better, and I go a little extra mile to help them.
And there are countless examples of just random acts of kindness or assistance needed, and just barely a look and somebody else runs over and helps.
It also means connecting with each other, recognizing that we all have a lot going on in our world, but we're here for the patients and their families. And if we can connect with each other, then we can help each other get through these times as well. Because it's challenging to be a healthcare worker these days. But when we connect with our patients, we're gratified by that connection, and when we connect with our team members, it helps us get through.
I feel like I act with H.E.A.R.T because I try to relate to my patients. I try to make sure they know my name, I know their name, I like to interact with their families, just try to slow yourself down, that you're not in a rush to get a job done.
For all healthcare givers, the way we communicate with the patient and their families is very, very important. Medical care and delivering health care is a relationship we establish with the patients and their families, and at the heart of every relationship is good communication. Good communication is associated with better physician and healthcare giver patient relationships, and better relationships are associated with better outcomes. So the way we communicate with people really helps us get the patient better.
You know, when you're on the phone, even though the person don't get to see you, they need to be able to feel your smile. And that's what I try to do. I think it's easy to just jump in. And I think H.E.A.R.T teaches you to sit back for a minute, pause, and actually hear what that person's saying, and then really get out of your own self and into their story.
H.E.A.R.T also uses our values of respect, integrity, teamwork, excellence, and service as we care for our patients, as we promote wellness, as we improve the health of our community.
And H.E.A.R.T actually stands for something. H.E.A.R.T stands for hearing, being really good listeners, empathy, and building a culture of empathy, apologizing when things go wrong. It's about responding, so making a fix, again, when things go wrong, and thanking people, thanking them for choosing H.E.A.R.T Regional Health.
Thanking the patient, thanking my staff members, thanking my techs for all that they do.
And I emphasize team members because we need to use H.E.A.R.T with each other as much as we need to use H.E.A.R.T with our patients.
I find myself at home practicing H.E.A.R.T, taking the time to listen without responding right away.
I help people, I serve people, I make people happy. That's what I like to do.
No matter what, I try to treat everybody exactly the same way. And I do experience this really great feeling.
When I walk the floors of the hospitals and I talked with our team members, is that human element. It's that happiness, that just sheer joy for doing what they do best and loving what they do. Recognizing that they're in the right place at the right time for the right reason. And that's very hard to find these days. But as healthcare workers, we see a lot, we deal with a lot, but when you can find that in your heart and display that every single day, that's what makes me smile. That's what fills my heart.